Today's topic we are going to discuss about practice of health education. My name is Dr. K.R. Pandian, Professor in Department of Community Medicine. Practice of health education, we actually need some of the medium for this. There are audio visual aids. Actually, the audio visual aids are radio, tape recorder, microphones, amplifiers, and earphones. The video aids and some of the educational materials that which does not require projection. They are chalk and boards, leaflets, posters, charts, funnel graphs, exhibits, models, and specimens. And some of them which require projection are slides and film aids. Again, we have combination of AV aids, which are television, that's films, cinema, and sound tape combinations. What are the methods in health communication? There are individual approach. This is done by personal contact, home visit, and by doing personal letters. And group approach. Group approach can be taught during a lecture classes, a demonstration, discussion methods, a group discussion, panel discussion, symposium, workshop, conferences, seminars, and role play. Then mass media approach by televisions, radio, newspaper, printed materials, direct mailing like posters, and health museums and exhibits, and folk methods and internets. These are some of the methods we can use in communication and health education. First, we'll see about the individual approach is given in a personal interviews in a consultant room, in the healthcare centers, or at the home. Here, the education given on matters of interest like diet, causation of the disease, and nature of the illness. The topics can be selected according to the relevance of the situation. The responsibility of the attending physician is very great important in individual approach. Okay, here the doctor can hint the lasting effects and volume of to the patients. Next, the Florence Nightingale, the nurse said that nurse can do more good in home for giving health education than in the hospital. The biggest advantage of health education and individual approaches we can discuss, argue on, persuade the individuals to change his or her behavior. It provides the opportunities to ask questions, and the limitations are the numbers reached are very small in individual approach. Next, we will see about the group approach. The groups can be selected upon the effective material what you are choosing. It can be a school children or pregnant mothers or postnatal mothers, or it can be a industrial workers. The effective way for educating a community can be a group approach. Here the choice of subjects must directly related to the group which are going to be test directed, for which, for example, TB control to mothers who are giving delivery. It is not important to them. Okay, if you very important topics are relevant topics are if you are going to give a oral hygiene practices to the school children, and if you want to teach about TB patients in a tuberculosis, about TB patients and accident to a industrial workers, we should have a suitable method that which includes audio and visual aids. Next, chalk and talk, that is a lecture or didactic method. Its definition of lecture is carefully prepared oral presentation of facts, organized thoughts and ideas by a qualified person. Here the chalk lends a visual component. It's a very important place in small group education. The talk based on topic of current interest and health needs. Here the group should be less than 30. The talk should not exceed more than 20 to 30 minutes. A too long a talk, people may become restless. Here the lecture method are more effective by combining with some of the flip charts like series of charts or posters. They are about 25 to 30 centimeters or more, shown one after the other. The message must be brief and to be on the point. Funnel graph is a piece of rough funnel or kagi fixed over a wooden board. Provides an excellent background for displaying cut-off pictures, graphs and drawings. Advantages: it is a pre-arranged sequence, helps in maintaining continuity, cheap medium, easy to transport, promotes thought and We can use exhibits, that's objects, models, specimen, etc. We can convey the specific messages. There are essentially mass media for communication, which can be also used in group teaching. Films and charts, for it's also one of the communication media, mass communication media. It is used with discrimination. They can be valued in educating small groups. Demonstration is a careful prepared presentation to show how to perform a skill or procedure. It is carried out by a step by step for an audience. For example, disinfection of the well, lumbar puncture, hand pump installation, construction of sanitary latrine, MCH activities, demo of producing oral rehydration salt technique. Okay, it is dramatizes by using the arousing the interest in people. It persuades the onlookers to adopt recommended practice. It upholds the principles of seeing in believing and learning by doing. It can bring desirable changes in the behavior. Group discussion is aggregation of people interacting in a face-to-face situation. They learn freely by exchanging their knowledges, ideas and opinions. Example, the matter can be on cessation of smoking or obesity reduction. The group should be comprised not less than 6 members or not more than 6 members and less than 12 members, all seated in a circle. There will be a group leader. He will initiate the subject, help the discussion in a proper manner and prevent side conversations and sums up the discussion at the end. There will be a person for recording the events, is called as recorder. He will record whatever is recorded and he will prepare the report at the end of the discussion. The limitations are those who are very shy, they may not take part in this discussion. Some of them will dominate the discussion. There will be an unequal participation in the members. Deviation from the subject makes it irrelevant unless properly guided. Next is the panel discussion. Here there will be 4 to 8 members qualified to talk about the topic, sit and discuss the given problem in front of the audience. There will be a chairman and a panel of 4 to 8 speakers. Chairman introduces the topics briefly and invites the speakers. There is no specific agenda, no order of speaking, no set speeches. After the main aspects by the panel speakers, the audience is invited to take part. Next is the symposium. It's a series of speech on a selected subject. Each expert presents an aspects of the subject briefly. There is no discussion among the symposium members like a panel discussion. At the end, the audience may raise their questions. Chairman makes the comprehensive summary of the entire session. Next is the workshop. It's a novel experiment in education. It consists of series of meetings, usually 4 or more than 4, with emphasis on individual work within the group with the help of the consultants and resource personnel. They will be divided into small groups and each group will show as a chairman and recorder. They will solve the part of the problem with the help of the contestants and contribute the group discussion and leave the workshop with a plan of action on their problem. Then the learning takes place in a friendly manner. They will be happy and democratic in atmosphere. They will under the expert guidance. Next, conferences and seminars, a large component of commercialized continued education. The programs are usually held on a regional, state or national level. They range from 1.5 days to 1 week in a length and may cover a single topic in very depth manner. Use of variety of formats to aid the learning process from the self-instruction to the multimedia. Next is the role playing or social drama. It is based on the assumption that the many values in a situation cannot be expressed in words and the communication can be more effective if the situation is dramatized by the group. The audience actively concerned and pays the sympathetic attention what is going on. The group size will be around 25 members. The useful technique in providing this type of discussions are they will be improved in human relationship and the school children. Mass media approach is education to the general public. For whole community, it's a one-way communication. In 1920, depending upon printed posted materials and pamphlets and newspapers. Then came radio, appeals to the ear. Then press caters primarily to the eye, and TV on both eye and the ear. Here they will transmit the message from a remotest places. Use alone inadequate in changing behavior. A brief account of the social mass media is given below. Television, it raises level of understanding and helps people familiarize with the things they have not seen before. Example, crime, and it's a one-way channel of communication. It cannot cover all the areas of learning. Next, radio, it's found nearly in every home, especially in developing countries. Both radio and TV can reach an illiterate population. It is purely didactic medium. Straight talks and quiz programs can be conducted, and much cheaper than the TV. Doctors and health workers can speak on the radio about health related issues. The local health issues may be identified and discussed in the radio. Internet is a compute based communication system. The instant communication across the world, like email, online chat. We have now social media platforms. It's a health related literatures from WHO and other health agencies. That's Government of India are available in online. Newspaper, you should provide a more factual, detailed, even statistical material. Unfortunately, health problems have little value on newspaper. Limitation, low readership in rural areas because of illiteracy. Next, printed materials, magazines, pamphlets, booklets and handouts can convey detailed information. Direct mailing now and folk media, these are other medium which can be used in giving the health educations. Posters and billboards, it's intended to catch the eye and create awareness. Message must be simple and artistic. It motivates such as humor and fear introduced into the posters. Places where the exposure time is short, streets and messages should be short, and the places where people have some time to spend, like bus stops, railway stations, hospital, the poster can be provided information. Next, health museums and exhibits which can attract large number of people. Thank you.